So student opinion of instruction surveys we will do on Friday. We'll have a guest speaker coming in and talk about biotech on Friday. I'll post his PowerPoint ahead of time for you guys to look at it. We will talk, but we won't have a PowerPoint lecture for Friday. And I will bribe you with candy. The grades still have not synced. I am still emailing with the guy in regards to that. As I've said in the past, those of you guys are kind of panicking about your grades because you didn't do so great on this last test. If you did it in Wiley Plus and you see a grade in Wiley Plus, eventually you will see that same grade in Canvas. I will make it happen on my own if they don't fix it by the time I have to do final grades. Okay? So rest assured it will get done. I don't mind if you keep emailing me. Sort of. Because it keeps me emailing the other guy going, hey, when are you going to fix this? So, that being said, let's talk about some cool stuff. So today, our major topics from Chapter 19 are inflammation and cell communication. So one of our major objectives, major questions, is what actually is inflammation, right? This is a new PowerPoint. You're not going to find it in that packet, Lance, if that's not the new one. But that page will help you at the end of this one. Sorry. Okay. So, what is inflammation? So in this book, they say that it isn't actually an immune response, but leads to immune responses. I always kind of considered it an immune response. Because this is how the cells actually get there that do the work. So it is referred to as an early physiological response, so something physical happens, to microbial invasion and damage. So they're talking about even when your cells are damaged, you may have an inflammatory response. When you have microbial invasion, you definitely want, for the most part, an inflammatory response. So for this response to happen, something has to trigger it. So for us, most of us have heard of the word histamine, right? Because this is one of those chemical signals that's released, especially when people are experiencing an allergic reaction. Because it's one of those triggers, it's one of those chemical signals that alerts our system to respond in a particular way. There are other chemical signals known as cytokines. So for the endocrine system, there are chemical messages that system in our body uses. Collectively, those chemicals like insulin, human chorionic growth hormone, thyroid hormones, right? All those hormones, right, those are chemical signals used by that system to communicate with each other. Right? If you guys are in A&P, right? I just lost it. The hypothalamus, right? He's kind of bossy in that brain portion of your brain, right? Likes to tell the anterior pituitary what to do, but he doesn't even do half the stuff that needs to be done, right? He sends signals to everybody else, like the adrenal glands and the kidneys and all these other organs, right? But it's an orchestrated system. It's a communication system. If you think endocrine is a crazy, complicated system, immunology's got it beat hands down. There are more cytokines than hormones, and they do more things and interact with more cells than any of the hormones in the endocrine system. And we're still, to this day, just scratching the surface in our understanding of the immune system. So for you guys, we're just like skipping over the surface in this class, right? We're just little touches, right? We're not even getting into the really serious details. And researchers are actively researching so much in the immune system. Every day there's new discoveries, literally, probably every day. So we're going to talk about some of these cytokines. There's a book probably about 2 inches thick at this time of all the cytokines and what we know they do so far. So again, I don't know them all. I know some. You guys are going to know a few, just a few, right? Just a few, so that you're familiar if you continue on in this field.
This will be a new content.
It's already posted, right? It did. Okay, I posted it last night. I know, I don't sleep. It's overrated. All right. So what's the purpose of inflammation? All right, so think about this as we watch the videos and we talk about this today. We want to contain the site of damage. We want to localize the response, right? We're going to send troops into this area where there's a problem, right? We don't need to send them all throughout the body. Inflammation is usually a localized response. Notice I said usually. One of its goals, too, is to eliminate any invaders. So any bacteria that got in, right, breach those barriers we talked about last time, right? If they got through the skin, if they got through the mucosal membrane of, say, the intestines, or into the lungs. How do we then eliminate them once they've breached our barriers? And then, of course, we want to restore tissue function because there's damage that happened, right? Maybe even more damage if an invader got in. We've got to get rid of them. Now, probably everybody in this class has experienced inflammation, right? What does it look like? What does it feel like? What are the signs and symptoms that you see when you have inflammation? Redness, heat, swelling. One more you feel. Pain, right? So the 4 cardinal signs, and they talk about 3 of them in your book, are the swelling. And so today we're going to explain why it's swollen, why you have edema. You have redness, and again we're going to explain why it's red. Although most of us nowadays understand when it gets red, it's because what is going to that area? Red blood cells, blood. Blood flow is increased to that area. So the next one goes with redness. It's heat, right? Because guess what? Your blood is hot. Because you're hot. The last that your book doesn't talk about is pain, right? Those are usually the 4 widely accepted cardinal signs that you see or feel with inflammation. Pain is more of a symptom though, right? Signs are things you can measure. You can see redness, right? You can see swelling. You can feel and measure heat. Pain is what we call a symptom. Somebody has to tell you, right? But anyone who's ever experienced inflammation will tell you it can be painful and different degrees of pain. And unfortunately right now we don't have like some little thermometer we can stick in your body and say, you know, you're at a pain level 9. We can't measure it. I don't know if we'll ever get to that level where we could actually measure it with an instrument, you know. That'd be kind of cool though, huh? Veterinarians Guess what? They never write down symptoms for their patients. Because your patient has to tell you that they're in pain, right? Or that they're nauseous, or they have a headache. Dr. Dolittle isn't real, y'all. Cats and dogs don't talk. People do. And this can make it difficult, though, sometimes, too, right? Because symptoms can be misleading as to the core problem. Where signs are usually pretty clear, because we can measure them, right? We can see them, we can measure them in some way. The last thing that can sometimes happen is loss of function, right? So depending on where this inflammation is happening, you may have loss of function in that area. And that could be pretty serious depending on where it's happening, right? If it's happening in the brain, this could potentially lead to what? Death, right? If you have swelling of the brain kind of tells the rest of the body what to do for the most part, right? If it's not functioning, neither are you going to be much longer. So we're going to watch the videos that I asked you to watch for homework. As we watch these, I want you guys to think about these questions. What caused the release of the inflammatory mediators? Right? So what was the initial thing that happened that it caused these chemical signals like histamine and cytokines to actually be released? And then, how do the white blood cells get to the damaged area? Right? How do they actually get there? And then, how do they get out of the blood vessels? And then, why the heck did we call them up to begin with? What do they do once they get there? What do the white blood cells actually do? What, Suzanne? Repairing. Yep, that's one of the answers. Okay. So these are my all-time favorite videos. We're going to watch the animation one first. Maybe, if my links will work. There we go. Just had to think about it for a second.
Inflammatory response is an important, non-specific.
So let's see. Yes, but not all the words are exactly correct, but they are pretty close. So I'll turn it on. This is open caption, right? Why is it so low?
It begins when injured tissue cells release chemical signals that activate the endothelium. The inflammatory response is an important, non-specific defense against tissue damage. It begins when injured tissue cells release chemical signals that activate the endothelial cells of nearby capillaries. Within the capillaries, adhesion molecules called selectins are displayed on the activated endothelial cells. These adhesion molecules attract neutrophils, slow them down, and cause the neutrophils to roll along the endothelium. As the neutrophils roll along the endothelium, they encounter chemicals that activate integrins, which are adhesion receptors on their surfaces. These integrins then tightly attach to adhesion receptor molecules on the endothelial cells. This causes the neutrophils to stick to the endothelium and stop rolling. This accumulation of neutrophils along the walls of the capillary is referred to as margination. The inflammatory mediators released by the injured tissue bring about changes in the environment that cause mast cells to degranulate and release histamine. Histamine causes vasodilation and an opening of the junctions between the endothelial cells, allowing fluid and leukocytes to leave the capillary and enter the infected tissue. The neutrophils now undergo dramatic changes in shape and squeeze through the endothelial wall into the interstitial tissue fluid. This process is called extravasation. The neutrophils, followed by other types of phagocytes, are attracted to the damaged site by chemotactic substances released by bacteria and tissue breakdown products. They ingest and destroy invading bacteria. The inflammatory.
So that's so I can rewind and fast forward. Okay, so question number 1. Here, let me pull up the question so we can look at them as we look at it. So, what caused the release in that animation of the inflammatory mediators? The splinter damaging the cells, right? So the damaged cells went, ow, right? Except they don't scream, ow. They instead release chemical signals, right? How did the white blood cells initially get to the area? Where are they coming from? The bloodstream, right? So we have that increased blood flow that we talked about that makes us red and hot. And then, how did the cells actually get out of the blood vessel to get into that area? That was a little complicated, huh? Well, they actually physically interact with the endothelial cells, right? Because those endothelial cells went about changes because of that call for help from the cells that were damaged. So they express those surface proteins, those selectins, so that when the neutrophils, which have receptors on their surface, came by, they interacted with those molecules, right? So it's like we're putting our hand out, right? They're flying by, and we're putting our hand out to grab them off that superhighway and pull them in. But in order for them to actually get in, there had to be additional changes to the endothelial cells, right? They had to kind of separate a little bit to have gaps so that they could actually move through the vessel walls and head into that area. Do you guys notice what else kind of headed into that area when the white blood cells did too? Here, I'm going to go to that point. So there they are, rolling along. Now they're actually there. So there's the white blood cells, right? In this case, a neutrophil, specific type of white blood cell. What's this? Chemicals. So what's your blood made out of? Yeah, it's plasma, right? Fluid. The fluid. Your blood is mostly water, right? Mostly water. Ooh. Fluid. Leaking into the area. That's what cardinal sign. Swelling. That's why you end up with edema and swelling. Because in order to allow the white blood cells to get through, we've unfortunately got to open the floodgates and let some of that liquid in there as well. The good news with that is that liquid isn't just water. It contains proteins, some of them that are really beneficial. Anyone think of any proteins that are going to help with this problem, especially if the blood vessel itself gets damaged? Where's my anatomy and physiology peeps? What cascade gets activated of proteins that are found in your blood when we have damaged blood vessels? We just leave the floodgates open? Like if we damage a blood vessel, we're just going to let the blood just go spewing out into our tissue forever? The clotting cascade, right? The proteins involved in clotting, right? So those are in that liquid phase. And under these conditions, right, especially the blood. Yeah, platelets are involved in it as well, right? But they're a little bit different from the proteins that actually will form the net structure. Platelets actually aren't even cells, right? This is why in A&P they call them formed elements. They were once a cell, that broke up into a bunch of little pieces that we call platelets. No. No. Fibrinogen, right? Fibronectin. Those are components that are proteins in the inactive form in your blood that are going to activate under certain conditions, especially when the blood vessel itself is damaged. And that's to seal up the gap, right? The platelets, too, can combine with that, right? Like little sandbags to help dam up that breach. But they themselves also contain enzymes, and when they're popped open, they'll help initiate the clotting cascade as well. So this is important, right? So this is where that fluid comes from. And then that fluid building up in that area, when this is happening, pushes up against our pain receptors in those areas. Hence why we usually experience pain. Other than the initial pain you may experience when you cut maybe your skin or something like that. Does that make sense? Okay. So now we're going to, one more question, right? What's the last question? So we got these white blood cells here. What do they do once they get here? Yeah, it's called phagocytosis. We're going to go through the specific steps of the process later in this chapter. But they literally, as you see here, they literally eat the invading microbes.
Phagocytes are attracted to the damaged
I don't want to listen to you anymore, girlfriend. I just want to watch. But you can see, right? They're literally engulfing, right? They're surrounding it, eating it like amoeba eat paramecium. It's literally the same process, right? And some of our specialized white blood cells can do phagocytosis. And so because of that, a lot of them we refer to as phagocytes. Like a neutrophil is referred to a lot of times as a phagocytic cell because it can do just that. It can eat bacteria. So that actually isn't my favorite video. This one is. And of course, we got to deal with the skip the ad.
I saw this one. It's long blood, right?
Yes, yeah, this one's awesome because you get to see it actually happen in a real live specimen. So I'll put on the captioning. And again, there's a few misspelled words, but this is actually not too bad. All right, let me turn back on the volume.
And you think they did this with
I have no idea how they did this.
some sort of
Yeah, I have no idea. It's awesome, though. It is so awesome. Yeah, ultrasound or something like that. I have no idea. It's pretty amazing, though. So those of you guys that haven't watched this, you're in for a good show.
Leukocytes are white blood cells that help fight infection. At sites of injury, infection, or inflammation, cytokines are released and stimulate endothelial cells that line adjacent blood vessels. The endothelial cells then express surface proteins called selectins. Selectins bind to carbohydrates displayed on the membrane of the leukocytes, causing them to stick to the walls of the blood vessels. This binding interaction is of sufficiently low affinity that the leukocytes can literally roll along the vessel walls in search for points to exit the vessel. There, they adhere tightly and squeeze between endothelial cells without disrupting the vessel walls, then crawl out of the blood vessel into the adjacent connective tissue. Here, leukocyte rolling is observed directly in an anesthetized mouse. The up and down movement of the frame is due to the mouse's breathing. Two blood vessels are shown. The upper one is an artery with blood flowing from right to left. The lower one is a vein with blood flowing from left to right. Leukocytes only adhere to the surface of veins. They do not crawl out of arteries. Some leukocytes are firmly attached and are in the process of crawling through the vessel walls, whereas others have already left the vessel and are seen in the surrounding connective tissue. When the blood flow is stopped temporarily by gently clamping the vessels, we can appreciate how densely both vessels are filled with red blood cells. Red blood cells do not interact with the vessel walls and move so fast under normal flow that we cannot see them. When the blood flow is restored, some of the leukocytes continue rolling, whereas all non-interacting cells are immediately washed away by the shear.
So Asia, I'm going to pick on you because I already know you're in A&P2. And you guys have done blood vessels already, haven't you? So, uh-oh, it didn't replay mine. I didn't catch it soon enough. I keep clicking the wrong thing.
Teams at work need to keep track of everything. Asana goes beyond management to help you fill in the blank.
One of these days I might sign up for
Leukocytes are
an account where they don't show videos. Ads. Okay. So I think that's where I want to be. Yeah. So arteries and veins are different, right? Anatomy-wise. Can you tell me something that's significantly different about an artery that maybe would make it difficult for these white blood cells to get out of it? What layers are there? So when you look at it under the microscope, what was that significant difference you notice about an artery as opposed to a vein? No, the structure of the artery. It has a layer that you don't have with veins. It's definitely thicker. What is that layer? So these arteries can change their diameter, right? They can get bigger and smaller. Why is it they can get bigger and smaller? Muscle. They have smooth muscle, right? And that's why they tend to hold that really pretty round shape. Like when you cut them in cross section, you look at them under the microscope, where veins will be like these jaggedy lines, right? Because they're much thinner, right? For the most part, just endothelial cells layer, right? They can be as little as one cell layer thick. I mean, veins aren't all that. And so we say arteries, A for away from the heart, right? And what is our heart? It's a pump to pump that blood through the system. So the closer you are to the pump, the higher the pressure, right? And this and therefore the speed, right? Think about how fast and how much pressure that blood is under in those arteries. And you want to jump, I mean, that's like on the highway jumping out of your car at 60 miles an hour. I don't know about you, but I'm not doing it. Right? This is not, physically it's not going to happen, right? That's why, those are two reasons right there why they're not going to jump out of an artery and get into the tissue. One, they're going to smack into a big old wall. Two, they're going way too fast. Way too fast, under too much pressure. Where your veins, a lot less pressure, a lot less layers to get through. Right, to be able to actually get into the tissue. Make sense? And again, a lot of it too is going to happen right at that capillary level, right, where we're talking about really small. But that's a venule, right? That's a small vein. A capillary, usually only about one red blood cell can get through at a time, right? So I mean, they're just like really, and then that's much slower flow as well, so much easier to get through. But this is a small vein. And you can tell that because of the width here. I mean, there's a cell here and a cell here, and as you saw, lots of red blood cells getting through, not just one squeaking through at a time, not single file type little situation. Does that make sense to you guys? So again, to review our questions. What caused the release? Right? So in that first video, right, was the splinter, it actually damaged the cells. The other thing that will actually initiate that response too is because what else could potentially get in when tissue damage like a splinter happens? The bacteria. So the bacteria even themselves will release things that will trigger a response. So tissue damage, number one, is usually going to elicit an inflammatory response, but also the invading microbes themselves. So this is a different picture from a different book, but I really like it. So you can see that splinter, but this is representing the microorganisms also getting in. So how do the white blood cells get to the area? Blood flow, right? Increased blood flow to the area. So therefore, what do you see and feel because of that increased blood flow? You see the redness, you feel the heat, right? That's all from increased blood flow. And then once they actually start heading out, you're going to get that swelling, and that's from the fluid leaking into the area, which will also push up against the pain receptors, which is why you also usually experience pain. So here they are, right, traveling out into the area and beginning to do their job. But as we said, in addition to the blood cells getting out, right, the white blood cells, specifically the ones that are called to that area, what else leaks out? Right, that fluid of your blood. And in that fluid, there are some important proteins that your book doesn't completely outline. It mentions 2 of them in this chapter, and I'm sure it's going to mention some of the others later, but I'm going to introduce them to you now. So the 2 your book mentions are complement, which we'll talk about next week. Transferrin, we've already talked about this though, but they didn't mention it in this chapter, but it's in your blood. What's the purpose of transferrin? Iron, right? Because remember, ferrin refers to ferrous, refers to iron, and this is to transport iron. And again, why is it that we want a protein that binds to and helps transport iron in this area? So any of our damaged cells that may have released iron, we want this to bind to it, right? Because if we leave it free all by itself, what's going to happen? Especially if it's a bacteria that got in. The bacteria is going to pick it up and use it, right? Because they need it for their metabolism too, but we don't want them to have it. So we're like, nope, that's mine. Thank you, mine. You can't have it. And that's what transferrin helps do, right? It helps pick up any loose iron and transport it away. No, transferrin is a protein that binds to iron to transport it. Iron isn't very soluble, so it doesn't travel by itself in our blood. So it needs a transport protein, and that's what transferrin is. It's specifically a protein that binds iron and transfers it. Complement is a series of proteins that has lots of abilities that we're going to talk about next week. Antibodies are proteins made by your immune system, by your adaptive immune system. So as you can imagine, we're not going to talk to them about them until next chapter, right? Because next chapter is adaptive. But it's important to note that they are found in your blood. And they could potentially help depending on what got in. You actually make a special class of antibody too that's found in all your secretions, your mucus, your tears, your breast milk, everything like that we're going to talk about. And then, as we mentioned earlier, clotting factors are there. So especially if you have blood vessel damage, right? And even depending on the damage to the tissue itself, it may activate some of these clotting proteins that are found in your blood to create a net-like structure, a clot, to contain this area, right? We don't want any bad guys that got in to get out. We also don't really want this, even our own stuff spreading too far, right? We don't want our blood just uncontrollably, spilling into our tissue. So we're going to wall it off because it's a crime scene, right? Death happened there. Cells died, right? More may be dying, whether we can get this under control or not, right? It's an active crime scene. It's even scarier than a real-life crime scene because, right, there is an invasion potentially happening, and we need to take care of the bad guys. So that's the really important thing of getting these white blood cells there, is to actually kill them, right? The invader, if there is an invader. What were you going to say, Susan?
I was just going to say, I thought blood clots were always bad, but they really could be beneficial.
It depends on the extent of it, right? But the main purpose is meant to be good. But it depends on where the clot happens, right? And how many clots, and, so. But, yeah, its initial purpose is meant to be good. But unfortunately, sometimes clots can be bad, depending on where they're located and where they go. So the same is true for inflammation, right? Sometimes it's really good, sometimes it's really bad, right? So how do the blood cells get out of the blood vessels, right? So they don't just jump out, right? They're called there. Specifically, the pro-inflammatory cytokines, right? Those chemical messages released by the cells, right, cause the endothelial cells of the blood vessels to express proteins on their surface that aren't normally there, right? They're going to put them out there and say, hey, we need help, right? It's like flagging somebody down on the side of the road, right? We're like, hey, over here, I need help. That's what these cells are doing. And not only do they call them over, they literally grab onto them, right? They grab their hands, right, and pull them in. So, of course, we call them adhesion molecules, right? Because they literally adhere to each other. They bind with each other. And then the cells are going to move out of that blood vessel. This is referred to as diapedesis, which means oozing, right? So they squeeze their way out, right? Extravagation, right? They call it. That whole process. So there he is, that beautiful neutrophil, that beautiful white blood cell. He's made it in. But he's not going to stop there. Right, he's going to eat. And he's the first one we're going to call up when we have inflammation. Right? So we're going to talk about all the different types of white blood cells. But one of the major players in inflammation that pretty much just goes into the tissue when it's called there during inflammation are your neutrophils. And these are your really good phagocytic, destructive white blood cells. These are your workhorses. This is your major army. Your macrophages are actually on scene all the time. And they're going to start eating right away, and they're also going to be part of that response where they eat something that got in and they go, hey, we need reinforcements. Problem here, right? And they're going to ask more of their friends to come. When you look at white blood cells under the microscope, we call these cells in the bloodstream, in a blood sample, a monocyte. They go through some physiological changes, what we call a differentiation, when they move from the blood into the tissue. In the tissues, they're referred to as macrophages, which means big eaters. Macro, right, is big. These guys eat lots and lots of bacteria and viruses and cell debris from dead cells. So they're there in all of our tissues all the time, but then we'll call in even more when we have invasion happening. And then the last are your lymphocytes. So these are the B and T cells, or B and T lymphocytes that your book mentions, that are part of your adaptive immune response. So again, we'll get to that level of understanding when we get to the next chapter. But you know, it's waves, right? So those neutrophils, there's going to be a lot of them all at once, and some macrophages, and then as the problem continues, if it continues, lymphocytes are going to eventually come on scene as well. So what do the cells actually do? They're going to eat the invaders, right? They're going to destroy and remove the invaders. And they also help with digesting dead cells and debris from the damage. They're the cleanup crew. So your book mentions pus, right? And they have a nice nasty picture. It's actually not that bad. I've seen worse. In your book, I'll show you in a moment. What pus is usually dead neutrophils. So this is one of those things, Susan, you're right? Is pus ever good? No. Pus is a sign of infection. Pus is never good, right? Pus is, for the most part, dead neutrophils. If they're dead, are they doing their job? No, they died trying to do their job. They died. And you've got so many of them, right, that you can see them on a macroscopic level as pus. So this is those dead cells. But the bad news is they're dying, right? And they're not killing the bad guy. So guess who else is in pus? The bad guys, the pathogens, the viruses, the bacteria, right? That's why you don't ever want to mess with someone else's pus, or not even your own pus, right? Because it's infectious. Gross. Yeah, I know. I don't think it's necessarily the word. I think it's just our own experience. Well, then they named it right? And then, of course, dead cell debris, right? If you have pus, you have infection. And you have infection that your body is not dealing with. You need to seek medical attention, right? Pus is not anything to be like, oh, it's all good. No, it's not all good, right? Pus is a bad sign. It's a sign of infection. Infection that your body is not taking care of on its own. Okay, so this is those shots from that different book, right? I really like the way these are drawn out, a little bit better than our current book, unfortunately. So I put them in here with all their little labels as opposed to without the labels earlier in the presentation. This is the drawing from your current textbook with the pus, right? So there's the pus. But I think everybody's seen pus, right? Unfortunately, we've all experienced this, maybe even personally. Now you know what it is, really, truly what it is, right? So hopefully you won't be like, oh, it's fine. Not really. Okay, so cytokines, so I lied. I'm thinking on Friday we will cover these last couple slides. It's not too many, though, because I think this is a good stopping point, especially since I only have 2 minutes to cover like 6 slides, so not happening. I didn't plan today as well as I did Monday, but that's okay, because we had some good discussion, I think.